Hello, welcome back to The Remedy. My name is Eric Gleason. We are going to discuss seasonal affective disorder today with the impending weather in which we are blessed with in the Oregon coast. We're here with Bill Simon from Coos Health and Wellness, who's a case manager and counselor. Thanks, Bill, for joining us.
Absolutely, you bet.
So, tell me a little bit, what is SAD?
So SAD, as you mentioned, stands for Seasonal Affective Disorder. And essentially what it is that it is something that impacts people's sleeping cycle or their biological clock, and they're fooled into thinking there isn't enough sunlight, and so they want to sleep, and they end up sleeping way too much, and it sometimes leads to basically the same symptoms that mirror depression.
So it messes with your circadian rhythm?
Yes.
That's tough.
Yeah.
If you get off like that, that can be hard to put yourself back on. How would one treat that?
So the first thing that we suggest, if possible, is for them to go to their primary care provider, because it is a pretty common issue, especially here in the Northwest. It impacts the further away you are from the equator, both north and south, because of how the calendar works and the sunlight works. So there are some pretty basic interventions that we use now that are pretty successful. The most common one is using light therapy, or the fancy word phototherapy. And all that is getting specific light designed to counter SAD, and you want to make sure that, if possible, you can talk to your doctor about finding out which one you want, because there are two types of lamps. Some of them are supposed to help your skin. This particular light is one that you want to use in order to help with your depression, and typically what they say is that you should use it for about a half hour in the morning. Okay. And that'll help your system stay a little more fresh. Also, you're supposed to have your eyes open. It's not something like you can go to a tanning bed and the light will impact you. It's actually through your eyes that they seem to have the most success.
So you would actually stare directly at the light?
No, you just need to have your eyes open with the light hitting you, where you're around. So
just looking at the light.
Exactly.
Okay. So would you have any pharmaceutical interventions if any of those things aren't enough? Or?
Yeah, the next level is usually, and again, that's why you want to see a doctor or your provider.
They'll make those decisions for you.
Yeah, and commonly what they'll use is a very standard kind of a low dose type of SSRI or common antidepressant. Wellbutrin is one that, like, for example, the Mayo Clinic on their website talks about as a pretty common effective medication to help counter it for those few months.
Okay. What other ways are there?
The other way is kind of what people in my line of profession would do, and that is sometimes people can benefit a lot from counseling for a little bit. Okay. We can teach them some different interventions, but specifically one of the methods that we use regularly in counseling for SAD that has a lot of success is cognitive behavioral therapy, or CBT. And that's where we work with the individual and we try and help them become aware of their thought processes, or what we call their schema, the concepts that they have or the views that they have. Often when SAD hits, you start to think more negatively, and that's what leads to the higher rate of depression potentially in some people. And what CBT does is it helps the person focus on controlling what they're ruminating on in their mind. Sure. And trying to come up with replacing those thoughts with more positive thoughts, and it seems to be very effective for treating SAD.
That's great. So if you find yourself in a position this holiday season or in the next few months, I know that this lasts somewhere up until, for our area, up until around April. If you find yourself in a position where you might feel that you fall into that category, get a hold of your provider. If you really feel that it is to a degree in which you don't, or you can't handle it, call Coos Health and Wellness. 266-6700. If you're in a crisis, 266-6800, and I'm sure they'd be more than willing to help. So for The Remedy and Coos Health and Wellness, thanks for joining us.